So birth control, both forms of birth control, estrogen, progesterone phase combined versus progesterone alone, both of it will result in a decrease in level of FSH and LH due to negative feedback. But one results in menstruation, and then the other one results in no menstruation. So let's talk about this first of all. So what will happen whenever the FSH level is lower and the LH level is lower in the female body?
So they're low. That means
Yeah,
the
so
cycle.
So no FSH. So for female, no FSH. That means that there's no growth in the follicles, no ovarian follicles growth. No LH means that there's no ovulation.
So progesterone levels really high.
So that's the other thing too. So we already said that the sexual cycle is whenever you have females have cyclic changes in their hormonal level. So their FSH level would increase, FSH and LH level would increase, and then it would decrease. And then it would decrease. So it's a cycle. The same with estrogen, right? Whenever the ovarian follicle starts to secrete estrogen, the estrogen level will increase. And then whenever the corpus luteum starts to secrete progesterone, the progesterone level will increase. And then when the corpus luteum dies, the estrogen progesterone level would decrease. So it's a cyclic changes. So now let's say with combined birth control pills like estrogen and progesterone, what will happen to that cycle, that cyclic changes?
Stop down.
They won't have it anymore. It becomes steady. They will now have a steady dose of estrogen and progesterone level throughout their body. So they will have a normal level. They won't have that cycle up and down anymore. Now they have a stable estrogen progesterone level in their body. So, what's the point I'm trying to get at? So, with a higher than level normal of estrogen because of the birth control pill, what will happen to the endometrial layer? They're taking estrogen, so they have a high level of estrogen and progesterone already. So what will happen to the endometrial functional layer?
No, it'll still get.
Yeah, it'll still proliferate, right?
Yeah.
They'll still get the proliferative phase of the menstrual cycle. Now what will happen whenever they have a higher level of progesterone in their body? They get the secretory phase of the menstrual cycle. So because the combined birth control pills, they have both estrogen and progesterone, that level in their body is normal. It doesn't go with that cyclic changes anymore. It's normal. So they still have proliferation of the endometrial layer and then secretion by the endometrial layer. So I'm not gonna ask the ladies since I don't want to be, but for the ladies who are on combined birth control pills, those last 7 days, those pills are just sugar pills. Why are they sugar pills?
So you can get it out. You
Yeah.
can still go through your normal cycle.
Yeah, because they have to finish up the last 3 stages, their premenstrual phase and the menstrual phase. So those sugar pills on the last 7 days is to decrease their body's level of estrogen and progesterone so that they can finish up their menstrual cycle. So that's the reason why individuals on combined estrogen and progesterone pill, they still undergo menstruation. They can still get pregnant because even though the FSH level is low and the LH level is low, survival of the fittest. There's gonna be one bad boy in there that can survive that harsh barren wasteland of, that's why they say, birth control babies are the smarter babies. They theorize that's the reason why.
I can attest to that because my son is a birth control baby.
Yeah,
He's
yeah.
very smart.
That's the reason why they say birth control babies are smarter babies because they're able to survive that harsh environment of low level of FSH and LH. They're still able to grow and they're still able to ovulate. All right, so what about pure progesterone-based birth control? Why is it that they're not able to undergo menstruation? Why they don't undergo menstruation? There is no estrogen to kickstart the proliferative phase. So you have a higher than normal level of progesterone, but you don't have the estrogen. And you won't have that increase in level of estrogen because your follicle stimulating hormones decrease. So your ovarian follicle is not able to grow, so those cells will not be able to secrete estrogen at all. So because of that, these individuals on progesterone-based birth control method, they won't undergo menstruation. So like those individual who gets those progesterone shot every 3 months and the Nexplanon, by the way, if you guys ever become doctors, don't ever recommend the Nexplanon. That thing is more harm than benefit.
Don't recommend
Put it in
which?
What's that?
Don't recommend what now?
The devil?
The Nexplanon.
Oh.
They put it in your arm, and it's good for 2 years. They always advertise how easy it is to put in. They never advertise how they're gonna get it out. You have to make an incision to pull it out.
I've never had that in my
Yeah, so
Absolutely
I give it to everyone in the military. All right, let's finish it off with pregnancy, and let's get you guys out here. All right, so are you guys good with this? Can I erase this? All right. What's that? Okay. Alright, so let's talk about pregnancy. So, the first thing we'll talk about pregnancy is what are the hormones associated with pregnancy?
Like all the ones you guys mentioned?
Yes. And some more. So there is your this is where it went. So there's your, oh, there's a reason why I threw them there. So there's your HCG, human chorionic gonadotropin. There's estrogen, there's progesterone, there's prolactin, and then there's oxytocin. Alright, so first things first, what does HCG do?
Prevents the corpus luteum from breaking down.
Yep, it stimulates it maintains the corpus luteum. Because what hormone does the corpus luteum secrete? Progesterone. Estrogen and progesterone, right? Because estrogen is involved in the growth of the fetus and the mother. And then progesterone, what does progesterone do? And let's see, fetus and mother. And it is also involved in the growth of the mammary gland. What does progesterone do?
Prevents premature contractions.
Yeah, it prevents contraction to prevent premature birth, right? And then it also decreases the level of FSH and LH, right? That's the reason why a pregnant lady doesn't undergo the ovarian cycle or the menstrual cycle. What does prolactin and oxytocin do?
Gets the breast set up for milk production.
So prolactin is milk synthesis, And oxytocin is what we call milk letdown. Essentially, ejection of milk ejection. And it's also involved in uterus contraction. By the way, so we all in here have a normal level of prolactin right now. Why is it that, the guys here, and then the non-pregnant ladies there, why is it that we're not like producing the milk and not like having any like lactation?
I wonder that every night. So, man, all this free protein.
It's because of dopamine. Dopamine inhibits the significant release of prolactin. That's the reason why these certain individuals where when they have certain medical conditions and their body, generally due to a tumor, they have a lot of prolactin. It can cause breast enlargement. And then these individuals with liver disease, they have breast enlargement. Also, kind of off topic, but that's one of the things I want to point out. So, which of those hormones can you detect in a pregnancy test? Human.
The ACG.
ACG.
The ACG is what you detect in a pregnancy test, a home pregnancy test. All right, now that we got the hormones out of the way, let's talk about the development of the, so what do we call whenever a sperm fertilizes a female ovum or female egg?
Starts with Z. Sorry?
Spermatozoon.
So it forms a zygote.
Oh.
It forms a zygote. But the process is called fertilization. So whenever a sperm is able to penetrate a female ovum, it's called fertilization. And the reason why the sperm is able to fertilize the female ovum is that it has to break the barrier to get into the female ovum. And the male sperm has an enzyme in the cap of his head called the acrosome. The acrosome, all it is an enzyme used by the sperm in order to penetrate the female egg. That's it. So, once it becomes a zygote, now it starts to exhibit one of the characteristics of life, which is development. So now it's able to grow and transform into what's called a blastocyst or blastocyte. And all blastocyte is just a layer of cell called the trophoblast, which will grow to become the placenta, and then an inner mass of cell called an inner cell mass, which becomes your embryonic stem cells. So it gives rise to your embryo. So from the blastocyst, so this is around, so this is during fertilization, this is from 0 to 2 weeks, and then around okay, and then from 2 weeks all the way up to 8 weeks, what forms is what's called the embryo. Yes, the embryo. And then from the embryo, after that is the fetus, which is kind of 9 weeks until delivery, the fetus. And then after delivery, up to 4 weeks after delivery is when it's considered a neonate. All right. First question I have for you guys. What maintains what does the placenta do? what maintains that pregnancy? The first question is, what maintains the pregnancy for that first 10 or 12 weeks or so?
Stuff in the uterus that's floating around.
Yes, the stuff in the uterus. The corpus luteum is actually, yes, so beta HCG actually maintains the corpus luteum for a couple of weeks, or all the way up to 12 weeks. So all the way up to 12 weeks, the corpus luteum maintained the pregnancy by continuing to secrete estrogen and progesterone. Why? Why is that? Because what is that primary structure during pregnancy that is supposed to kind of provide oxygen, provide nutrition, wash away waste, and kind of help secrete hormones to maintain the pregnancy? What's the name? The placenta.
Yeah.
So why doesn't the placenta do that right away?
It has to form.
It has to grow,
Yeah.
right? Because we already talked about how the trophoblast has to grow and differentiate to become the placenta, so it takes time. So because of that beta HCG, the hormone, it keeps the corpus luteum alive a little bit longer so that it can take over that role until the placenta is fully developed. Then it takes over the job. So the placenta is there to help maintain the pregnancy, either by providing nutrition, oxygen, but it's also 12 weeks afterwards, it also starts to secrete estrogen and progesterone to maintain the pregnancy. So that's kind of like the main thing, the other main thing I want you guys to know about pregnancy. Corpus luteum, up to like 10 to 12 weeks, corpus luteum has to stay alive to maintain the pregnancy. After the placenta fully develops, then it takes over the job. So, now that we talked about that, let's talk about labor and delivery. Talk about that. Let's talk about this. Let's talk about L&D, labor and delivery. So, what is the term for the false labor contraction, and how does it differ from a true labor contraction?
Braxton Hicks.
Braxton Hicks. Knew you were gonna be the person to answer. So your false labor are these weak contractions called Braxton Hicks. How does it differ from a true labor?
True labor is involved with hormones.
Yeah, true labor hurts. True labor actually hurts. So true labor signals labor. That's what they call true labor. So one, it hurts, and two, it signals the beginning of true labor. So what are the 3 stages associated with true labors? With true labor?
Oh, there's 3.
Dilation.
So dilation. What's the other stage?
Contraction? No.
Expulsion.
Oh, okay.
And what's the 3rd stage?
The placenta.
Placenta.
Is that called second labor? What was that name for?
What's that?
Second labor?
Second
I
labor.
don't know where I got it. Honestly, that just came in my head. I don't know where I heard that from. Never mind.
Yeah, it's
A
expulsion.
lot of
and
people say
placenta.
that because you're not really pushing it, it kind of just falls out of you, the
Yeah,
placenta.
your uterus will just like, it just fall right out.
Man, is that the organ people sell too?
Yep, placenta.
They sell it to
That people eat, that
Yeah.
cats eat.
It's disgusting.
That's interesting.
It's a lot
You
of
know what they
nutrients.
eat it?
Is that cannibalism in its own way?
I mean,
It's like the most
Yeah.
nutritious part, right? That's why a lot of animals eat.
what stage is the longest stage of labor and delivery?
Dilation.
Dilation. So why is it the longest stage? What's going on during dilation?
Cervix and dilating.
Yeah, so you have your cervix effacement, which is thinning, and then we have the cervix dilation. So I was wrong, it's not like 2 millimeters, it's like 10 centimeters. It's pretty much a baby's head.
Yeah.
Yeah, so it's like 10 centimeters. So that's the reason why it's the longest. So what is expulsion?
Pushing.
Crowning. Starts with the
Yeah.
crowning.
It starts with the crowning and ends with the baby coming out. So what you get is crowning, which is, you can see the baby's head, and then the end of it is just the baby coming out completely. And then the placental stage is whenever you have the explosion of the placenta. Not explosion of the placenta. Pretty much the placenta come out. So that's the 3 stages of delivery. All right, last things to finish with. And then, good on time. All right, milk. So we already talked about milk synthesis is by the hormone prolactin. Milk letdown is by the hormone oxytocin. What is the difference between cow's milk and breast milk? So let's be specific. The lactose content in cow's milk and protein content, the lactose content in breast milk. So which one will have higher lactose content?
The cow.
It's actually the breast.
What?
Yeah, the cow has more protein. The cow has more protein but less lactose.
I thought that would be switched.
Yeah, breast milk has more sugars, amino acids, but it has less protein. Because the only protein that's in breast milk is your amino acids and antibodies. So that's how the baby is able to have passive immunity, specifically IgA antibodies and some IgG antibodies. Cow milk is bad because lower in lactose content and higher in protein content, baby is not really able to digest all that protein yet. So the bacteria starts to digest it down. So it leads to a lot of androgynous waste. Androgynous waste, a byproduct of protein breakdown, that's the reason why it leads to diaper rash and all that stuff. That's the reason why they don't recommend like cow's milk for the baby. Otherwise, that's pretty much it. Any questions or anything?